Welcome you all on behalf of Team PrepMedico and Prep FRCS. I am Manikandan Kadarpel. We, as a team of 15 surgeons from UK, we have been doing the FRCS courses for the last 2 years. Unlike the regular intense course, ours is a kind of a mentorship program along with Viva training, which happens over a period of 3 months. We try to give more importance to one-on-one mentoring. Last week we had general surgery Taster Viva sessions, and this week we are planning to discuss some critical care scenario. Usually in the FRCS exams, how much ever you prepare, there will be 1 or 2 scenarios which will surprise you. Okay. Similarly, this time the scenario which the candidates had for one batch which had for general surgery was a patient who had underwent multiple breast surgeries with multiple flaps, which was a complete shock to me. Okay, to be knowledge required for a non-breast trainee for this exam is up to ST4 level. Every one of you to have a knowledge equivalent to ST6. This time we are planning to introduce specific lectures for breast surgery specifically to all the trainees and non-trainees. We are also planning to introduce upper GI lecture for everyone just to build up their basic knowledge. Similarly, we are going to give a lecture on transplant as well. These are all the new additions which we are planning. I am not going to stress you with in terms of timings, okay, but I'll be just questioning you, and don't get stressed, and you can, the aim of this is to just understand how the questions are. Okay, fine. Sure. So you have started your job today as a consultant general surgeon, and your registrar, okay, is calling you in the night when you are at home, telling that there is a 28-year-old boy, okay, who is brought to the A&E following a road traffic accident. Your registrar is panicking. It's a district general hospital where there is only an ortho registrar and a general surgery registrar alone is there. He is calling you, telling that the heart rate is 130, blood pressure is 60/40. Okay, you did well. You have, means your thought process is good, your knowledge is good. Of course, you have some difficulties in producing the answers, which is extremely common, very, very common. Almost everyone has this problem when we start, but overall your knowledge is good, thinking of whatever is the next line of management. Any questions so far? So I think again we have discussed quite a lot of scenarios today in critical care. Obviously you would have again I try to keep the critical care scenario very simple because this is the first exposure for the scenarios for you. Next week for HPV, okay, scenarios on HPV we will discuss next week, and in the meantime again try any questions or any queries please put up in the group.